Hello everyone, I'm Dr. RMD, pediatric resident at Dr. RML Hospital, that is PGIM Delhi. Today I'm going to talk about NEET 2024 preparation strategy because after my previous video on INICET 2024 strategy, I had got many comments in my chat box that I should also prepare a similar strategy for NEET. So this video actually took some time, around 10 days, because I had to go back and research last 6 years NEET question papers and I came up with the new strategies here. So mainly I'll be discussing about the 10 game-changing subject which no one has talked about till now. I had gone to many previous YouTube videos on how to give strategies for NEET PG 2024, how to prepare, and I didn't find any video based on the in-depth analysis of previous 6 years NEET question papers. So I'm going ahead with this and not wasting much time. There is no much of bullshit in this video. Directly talking straight to straight, we'll be talking facts. Okay, so coming to strategy number 1. The main important thing in strategy 1, that is the main important thing I noticed in previous 6 years videos, previous 6 years NEET question papers, is that previous year questions don't frequently repeat in NEET as against INICET, where I also commented in my previous video, the link is in the description, that previous year questions usually repeat in INICET and these previous year questions or previous year topics keep on coming up, but in NEET that is not the case. Even though they repeat, it is not much significant. So you should be knowing mainly concepts, you should be knowing topics in general. So for that, previous year questions are not a good reliable marker. That's what, when I found that the number of questions that are asked in NEET PG from a particular subject actually carries more significance than the which questions are asked in NEET PG. Okay, so total number of questions asked from subject carries more importance. That's why when anyone asks me how to prepare for NEET PG, the first revision strategy is that you have to go through revision videos, because your main videos will contain all unnecessary garbage, rubbish information which is not needed to crack NEET PG. But the revision videos are mainly focused on previous year questions. If revision videos don't cover previous year question, then that revision video of that coaching app is not a good video. It's not a good coaching app. So revision videos means it should be based mainly on previous year question, and I'm definitely sure that these revision videos will cover all the questions which are asked in previous 3 years at least. So based on that assumption, I realized that previous year topics are not much important, but these revision videos which are there in coaching apps are more important. So I came up with a new strategy that instead of going behind previous year questions, you should go behind total number of questions that are asked from each subject, which is a better criteria. So I did a subject-wise analysis of how many questions are asked from each subject in every NEET PG from the past 6 years. Okay, this is 6 years data, and this is not me talking, not from my experience. This is scientific evidence from past 6 years of data. Okay, so I made this graphical this columnatic representation. Okay, here I took all 19 subjects on one side, and NEET PG 2018 19 up to 23 I took on the y-axis. Okay, now what I found was that few subjects showed some remarkable changes, okay, over the years. Okay, it's not like anatomy, which was asked earlier, is the same which is asked now. See, for example, anatomy in 2019 was asked, 11 questions were asked, but now hardly 5 or 8 questions are asked. Are you noticing this? There's a dramatic change over the past 6 years. So there was a difficulty when I tabulated this column, because NEET 2018, 2019 and 2020, these 3 years, NEET was asked for 300 questions. Okay, this was 300 questions and 1200 marks. Okay, and from 2021 pattern changed and it became 200. Okay, so now for these 300 questions, what I did is to make it uniformly, to maintain the uniformity, I converted this number of questions asked from 300 questions to 200 questions. Okay, I rounded it up to the nearest figure, so I got an approximate value like this. Okay, so based on this, you can see that there are some differences. You'll notice some changes in this. Say, for example, for example, ENT. Okay, initially only 4 questions were asked, but gradually in 2022 it went up to 9 questions. So 4 questions to 9 questions, it is double increase. Okay, even though you had studied earlier in 2018, if you had studied ENT, you would have only got 4 questions in NEET, but now you are getting 8 questions or 9 questions. Similarly, you see for surgery, 17 questions were asked in 2018 NEET PG, but then in 2023 it went up to 27 questions. 27 questions were asked in NEET 2023 from surgery alone. That was about 1/8 of the total number of questions, more than 1/8. Got my point? This is a significant change that you're seeing. See, OBG also 17 questions, then on NEET 2022 it went up to 25 questions. Okay, you'll also see the significant change. For example, forensic in 2020 was asked, only 5 questions were asked, but in 2023 8 questions were asked. See, these are small subjects, even 1 or 2 questions plus or minus will create a huge difference here. Okay, so what I did to make understanding easier and to make it more palatable, I converted this data into a graphical representation, and the results actually shocked me. The results literally shocked me. See, this is the graph for anatomy. Okay, see, anatomy in 2018-2019 there were more than 10 questions asked usually. Okay, and now hardly 8 or 5 questions are asked. In 2022 only 5 questions were asked. In 2023 8 questions were asked. You see the graph is downtrending graph. Same for physiology. Physiology also follows anatomy. Initially in the first half, I'll call it the first half, okay, the first half of NEET PG, that is 2018 to 2020, more than 10 questions were asked. In 2019 physiology almost 12-13 questions were asked, but now it is always less than 10. So anatomy plus physiology combined doesn't go more than 15 questions. Why I'm telling this anatomy plus physio combined? Because in next slide you'll see that biochemistry, which is a short subject, which is not a big subject at all. It takes less time than anatomy and physiology combined. In last NEET 2023, 15 questions were asked. 15 questions. Remember, 15 questions from biochemistry alone, and this graph is always in a rising trend. So what does this tell you? This tells you that stop your focus on anatomy and biochemistry, give minimal focus on that, start focusing more on biochemistry, because once this graph goes up, it's mandatory that it will remain in that trend only, because this trend is not from past 1 or 2 years. It is from 2019. From 2019 this graph is going on increase. From the past 5 years, number of questions in biochemistry are going on increasing. That is because the research in biochemistry, especially in genetics, is increasing. That's why examiners are forced to give you more questions, because more updates are coming on, more information is coming on from biochemistry end. Got my point? This is where you have to change. In first year, anatomy physiology carries less importance and biochemistry carries more importance. If you give same amount of time, you will score more in NEET PG if you give more importance to biochemistry. These are the subtle differences which I am actually pointing out through graphical and statistical analysis. Okay, this is not me telling out of my own experience. Okay, coming to the second year subjects, patho, micro and pharmac, there is no much difference. Okay, it follows almost a straight curve. Okay, there is +2 or +3, plus or minus 3 questions difference, but as such it follows a straight same curve, so you don't have to worry much about this. Then coming to ophthal and ENT, again a significant increase. See, this blue line is ophthal. Okay, so ophthal graph is going on increasing and ENT graph is steadily increasing. So these two are minor clinical subjects. So minor clinical subjects are never to be ignored, because these, even though the portions can be covered in a day or two, if you when you're revising, I mean based on the revision videos, but still you shouldn't neglect this, because these questions are asked more frequently in the NEET PG. That means in the over past 3 years the frequency has increased. That means in future also it will either remain the same or it will go on increasing. Decreasing trend is less likely. Okay, so this exam is based on probability, so you have to go according to probability. So PSM is almost the same. There is more of decreasing trend only in PSM questions, but it is more or less the same only. There is nothing much to be done in PSM. Then pediatrics, see this curve from 2020, the curve for pediatrics has literally gone up. It has shot up. Okay, so again, pediatrics, a small clinical subject which can be completed easily, that carries more significance. Medicine, see this 3 years of trend, 3 years of trend going upside. Okay, so 1 year may be a variation, 1 year can easily be mistaken, but 3 years going up is not a coincidence. Okay, coming to surgery, say literally surgery is the only subject in the entire 19 subjects which has shown a consistent increasing trend. Today, if you ask me what is one subject that can change your NEET PG 2024 result, that is surgery. I'll tell you why. See, a NEET 2019, okay, hardly 15 questions. And see this graph, how it's climbing, the steep climb in this graph. By NEET 2023, 27 questions were asked, 27, almost 80% increase in the number of questions that were asked. So that means if you're devoting equal time to medicine and surgery, you're doing it wrong. You have to devote more than 75% of the time you're devoting from medicine to surgery. That is because surgery is showing this increasing trend. So definitely in the upcoming exam, surgery will be definitely about 20 questions. Got my point? This is where your strategy should be for your 2024 preparation. Next, one more subject which has shown increasing consistency is increasing trend consistency is OBJ. See, again the graph is going high. In 2022, up to 25 questions were asked. 25 questions were asked from OBJ. Surgery plus OBJ, 25 plus 27. Almost 1/4 of your question paper was just from surgery plus OBJ. And this was not only the case of 2022, even 2023, 2021 also same trend was followed. I'll show you in the upcoming graphs. Okay. Now coming on to short subject, there is also increasing trend here. Okay, I took forensic, radio, ortho, anesthesia, and dermat. See this blue line you are seeing, this blue line, this is forensic. And forensic is such a short subject, you can finish in 2 or 3 days. And you see the number of questions that are asked, the graph is always increasing. Now around 8 to 10 questions are asked. Earlier only 4 questions were asked. Now 8 to 10 questions from forensic. Such a short subject. You read whole 1 week of anatomy, you will get only 7 questions. But forensic, you read for 2 days, you will get 8 questions. This is called smart preparation. Got it. One more subject which is showing a good trend is ortho. See, this yellow line is ortho. Ortho is also consistently asked between 7 to 8 questions are asked in ortho. And 2 subjects which you should be very careful: radio and dermat. See this, radio and anesthesia. See this green line is for anesthesia. Anesthesia is consistently coming down. Over the years, number of questions in anesthesia are coming down. And this radio is this red mark. Okay. This red mark is also coming down consistently coming down. So radio, hardly 2 questions were asked last year. Before that also 2 or 3 questions. That means you should not devote much of your time to radio and anesthesia. Whatever is needed, study only that. Or even if you don't study also, it's fine. From grand test or maybe from here and there, you'll study this from Pearl somewhere, or when you're studying other subjects. Dermat has been consistent enough, okay, but dermat has been showing much fluctuation, so I don't want to comment. So you got my point. The point is, this is strategy number 1. That is, you have to differentiate between uptrending subjects and downtrending subjects. What are downtrending subjects? Downtrending subjects are those whose number of questions asked in NEET PG are consistently showing decreasing trend in the past 3 years. So these subjects are anatomy, physiology, radio, and anesthesia from past 3 years. This is not 1 year data. This is 3 years of data. Total 6 years combined. This has been showing a downgoing trend. So these are the subjects which you should invest less time in, because these are the subjects which are not going to benefit you a lot. And uptrending are those subjects whose performance is consistently very good in the past 3 years. So the probability lies in the fact that you go along with these subjects. See, no one knows exactly how NBS will frame the question paper. That is for sure. But the last 3 years trend shows that the subjects which have been asked from the last 3 years consistently will definitely be asked consistently this year also. It's not like suddenly they'll ask 20 questions from anatomy. That is not going to happen. Or it is also not going to happen that they'll ask 10 questions from radiology. That is also not going to happen. So this trend which is there, that's approximation, that will continue. Okay, so according to statistical analysis, uptrending subjects are surgery. Surgery is the number 1 subject, then comes OBG, then comes biochemistry. These 3 are the top uptrending subjects. If you invest your time in this, you are never going to lose. You are going to gain only. This is called smart preparation for NEET PG 2024. Okay, and along with that is ENT, ophthalm, and you can also add forensic medicine. Forensic medicine is also very helpful. It has been showing uptrending. These 5 subjects. Okay, this is strategy number 1. Now, what I realized after that is just subject-wise analysis is not enough. So I also went ahead and made a pan-subject analysis. I combined all the subjects, all 19 subjects, and I saw at the data. Okay, and I realized that it is difficult to manage, difficult to compare between old pattern of NEET and new pattern, because things are very different. So what I did, I divided the data into 2 aspects. One is old NEET and new NEET. Old NEET is from 2018 to 2023. Sorry, 2018 to 2020, and new NEET from 2021 to 2023. So I tabulated this data like that. Okay, so these 3 up to 2020, I classified them as old NEET and this one as new NEET. Okay, I combined all these 3 data separately, and I combined all these 3 data separately. Again, I'm telling, this old pattern NEET had 300 questions in the exam, but I converted it into 200 questions. Okay, so that I can uniformly compare these both groups. So after this, I made a graphical representation, and again the details that I got, the result that I got from that was shocking. See, this is the graph that I see. These are the subjects. Okay, the blue lines, okay, the blue lines that you see, blue line represents old NEET, and this orange line represents new NEET. So what you're seeing here, see, there are many lessons to be learned from this graph. In old NEET, that is between 2018 to 2020, anatomy and biochemistry, these first 2 curves are for anatomy and biochemistry, they were asked they're asked much frequently. But in new NEET, the number of questions from anatomy and physiology have decreased. First point. Second point, biochemistry has been consistently rising. In new NEET, biochemistry has much more questions than anatomy and physiology combined compared to old NEET. Old NEET where the biochemistry questions are very less. Okay. Third point, patho, micro and pharmac are almost the same. There's no much difference. They show similar trend, and you have to note that pharmac is the subject where more questions are asked compared to patho and micro. So if 3 subjects are there in second year, the more importance you have to give is to pharmac. Okay. Fourth point, Optal and ENT have come up in a big way. Okay, Optal and ENT, more number of questions are asked. That means that clinicals are carrying more importance. Fifth point, see this big peak that you are seeing here. This is a peak for clinical subjects: pediatrics, medicine, and OBG. Pediatric medicine, and OBG and surgery. All this, pediatrics, medicine, OBG and surgery. All these 4 subjects are the topmost ones. In the recent NEET, that is the recent trend from 2021 to 2023, more clinical questions are asked as compared to pre and paraclinical. This should be in your mind. So whenever you are studying, you have to give more importance to clinical subjects because more number of questions are asked. Okay. Now, one more important thing you will see here is that PSM has no much of changing trend. Okay. And then you will see that forensic, oh my god, there is a huge increase in the number of questions asked in forensic in new NEET pattern, that is from after 2021 over this past 3 years. And then you will see that radio and anesthesia number of questions have decreased significantly. Radio and anesthesia have come down, and ortho number of questions have gone up. Dermat is almost the same. So in minor subject, if you want to focus something, then you have to focus on you have to focus on forensic and ortho, focus on clinical subjects, focus on ENT and optal, and focus on biochemistry. This is the take home message from this graph. So I went ahead and I prepared pie chart analysis. Okay, this is a pie chart for new NEET only. This is from 2021 to 23. I took new NEET PG data, new NEET, that is new NEET pattern, and I analyzed this, and I found that most of this is the percentage of questions that will be asked in any exam from past 3 years. Okay, so if you compare NEET 2024 also, it will be roughly the same only. So you see here, OBG, surgery, medicine, okay, pharmac, these carry the most important. This carry the highest number of questions that are carried in NEET PG from past 3 years. So that means OBG, surgery, medicine, and pharma almost accounts up to 40 to 50%. Okay, then comes biochemistry, patho, okay, and pediatrics. These account for the rest. So that means that this new NEET pattern has few changes, few conclusions that we have to draw. That is, clinical subjects are superior. Clinical subjects are superior in NEET PG new pattern. Okay, surgery, OBG, ENT of them especially. Anatomy, physiology importance has gone very much low. Okay, anatomy, physiology are not much important. New players, new uptrending subjects, that are biochemistry, forensic, optal, ENT, and pharmac. These are the subjects to be focused on. And short subject you have to focus on to forensic and ortho. Okay. So I had researched few things on YouTube. Before making this video, I went through details, like I had to research, and I didn't find any video which explains all these things, because most of your NEET preparation, whether it is by coaching app or your mentors or YouTube influencer, they'll mostly talk about things that are happening since 2018. Even toppers will also tell that they have solved question paper from 2018, but things, as you noted here, have changed from 2018. Okay, it is not the same. 2018 to 2020 is a different era, and 21 to 23 is a different era. So we are going to follow 21 to 23. Okay, so based on this analysis, so far I have given you 2 strategies. One is subject-wise analysis strategy and pan subject analysis strategy. Now, third thing which is very important is that my friend Viraj told me that since I made this pie chart and showed him, and he told me that, okay, I am going to study on clinical subjects. So that means it will cover more than 50%, and I can easily score in NEET PG. That means I'll definitely get a very good rank. So is the strategy correct? So there is one limitation to this graph, the graph which we saw here. There is one limitation to this graph, and the limitation is time. Time is a limiting factor, because it doesn't mean that you study, for example, medicine. Medicine forms 10% of the total questions asked in NEET PG. That means in the upcoming NEET 2024, out of 200 questions, 20 questions will be from medicine. But to study that 20 questions, you have to invest almost 1.5 months. Is it worth it? When time is a limiting factor, that is not worth. So here, when you limit everything with respect to time, when time becomes the limiting factor, the previous chart carries less significance, and the more significant goes towards the strategy 3, that is called the weightage. Weightage is the ratio between total questions that are asked in NEET PG subject wise to the time needed to complete that subject for NEET PG. when you equate a subject that needs to be studied with respect to time, that becomes the weightage. So that means if you study 1 hour of particular subject, the number of NEET PG questions asked from what you studied is more, then the output of that subject is more, the weightage is more for that subject. Got my point? I'll explain you in this statistical analysis. Okay, so again I took the same data and I took new NEET PG data, okay, that is NEET 2021-23, and I added all the number of questions that were asked till in the past 3 years. Okay, so anatomy, so per year you know that 200 questions will be asked totally. So in 3 years we have 600 questions. So out of 600 questions, anatomy 20 questions were asked out of 620 questions. Biochem 37 questions were asked out of those 600 questions in the past 3 years. Total 37 questions. Surgery 70 questions were asked. Okay, PSM 44 questions were asked, and dermat 12 questions were asked. So this is the list of the subject, list of the total number of questions asked from each subject in the past 3 years. Now what I did, I took percentage of these. Okay, so that means that in anatomy 3.4% of questions are asked, in surgery 11.8% questions are asked, in biochem 6.2% questions are asked, and PSM 7.4% questions are asked. What does this mean? This means that in NEET 2024, which is a 200 question paper, in that number of questions which come from anatomy will be 7, because 3.4 for 100 questions. So for 200 questions it will be 7 questions. Okay, so biochemistry will carry almost 13 questions, and surgery will carry around 24 questions. Okay, this is an approximation, but the figures will be around somewhere around plus or minus 10% from this. Got my point? So now I got how much percent of questions are asked from each subject from the past 3 years, how much percentage was asked, and this is roughly the representation of 2024 data also. I am very sure that 2024 question paper will be based on this only. It is not very different from this. Okay, so now I had to equate time, and here comes the tricky part. How do I equate time to a subject, allotted to a subject? Like you may prepare from MCQs, you may prepare from videos, you may prepare from notes, you may prepare from any other source. So how to equate time that is given to study this 3.4% or 6.2% of that subject? How to devote that time? How to calculate that time? So this was a tricky part. So here again I want to put a disclaimer that I am not being funded by any coaching institute, or I am not supporting any coaching institute. I took this data from Marrow because I have been using Marrow for my preparation, and most of the people also use Marrow. So I thought this would be a better strategy. Okay, so what I did was, you know that in as I said in the beginning, NEET PG questions don't depend on previous year questions. Okay, but it depends on concepts, and these concepts were asked previously. Concepts can repeat again, topics can repeat, but same type of questions don't repeat in NEET. So these all NEET PG previous year questions or the concepts are discussed detailedly in revision videos. So if there is one marker in the whole of Marrow app which will actually give you positive advantage over others during this 3.5 months of preparation, that is the revision videos, because revision videos will have concepts, it will have previous year questions, and it will help you any type of question that was asked in the previous 3 years. If such a question comes, you can easily answer, or even though it was not asked previous also, you are able to answer it fairly. Okay, so what I did was I calculated number of hours of revision videos which are allotted by Marrow to each subject. So anatomy allotted 8.7 hours of revision videos, 8.7 hours. Okay, pharmacology was allotted 9.1 hours of revision videos. Medicine was allotted 31 hours of revision videos, and PSM 15.2. Radio was allotted 6.9 hours. So I took this ratio, I took this time, okay, number of hours, and then I divided this percentage of each subject, okay, percentage of questions that can be asked from each subject with the time, that is the revision video time, and what I found was the weightage ratio. Okay, this is not in a significant percentage. It doesn't mean that it will give 39 out of 100 marks. No, it is just a relative comparison between subject, that if you give 1 hour of your time of your revision videos to each of these subjects, how much you're going to gain in your NEET PG 2024 exam. Got my point? Which means that if you're giving 1 hour of your time for revision videos or any preparation, maybe MCQs, you're going to get 39% output for anatomy, but the same 1 hour of your time for biochemistry will give you 61% of output, because biochemistry questions are asked more in NEET exams. Got my point? Also that biochemistry number of hours is also less. Sorry, here it's okay, 10.1. But when you compare biochem with, for example, medicine Medicine, even though the percentage of questions is 10.3, biochemistry is 6.2, medicine percentage of questions is 10.3, but then if you're devoting 31 hours, the output that you get is only 33%. But biochemistry, you with the same 1 hour of preparation, you will get 61% output. Got my point? So this is with relation to time, and when I plotted this with relation to time, this percentage, no, this is a vague number. Okay, this number has no significance except that you can compare it relative from one subject to another subject. Okay, and when I plotted this in graph, I was very shocked to see this type of graph. And this note here, biochemistry. Okay, whatever comes above 50% are your high yielding topics. Biochemistry, pharmac. See this PEDS. PEDS is less to study, but more questions are asked. That is the meaning of this. In last 3 years, more questions were asked, and you need less revision, less time to watch these revision videos, and it will give you more output. So you will be able to answer more questions in NEET PG 2024 or your grant tests also. So see this surgery, OBG, PSM. Okay, sorry, not PSM, forensic, ortho, psychiatry. So this is very different from the traditional approach. In traditional approach, maybe in coaching videos or in YouTube videos, you will find that people have divided into first year and second year subject, which are high yielding, okay, and then clinical subject, which are high yielding but takes more time, so you don't have to study, and short subjects which are actually high yielding, okay, but then it will take less time, so you have to focus more on that also. So this was a traditional approach. I strongly disagree with this traditional approach, because what I got from my statistical evidence and my scientific approach is this curve. Okay, this is the curve that I got. This is the way you have to approach. There is nothing called first or second year subject. There is nothing called big subject, small subject. There is nothing. The formula is very simple. These 10 subjects: pediatrics, psychiatry, pharmac, ortho, surgery, OBG, biochem, forensic, dermat, and patho. These 10 subjects are the high weighted subjects. This is the ultimate analysis. This is the take home message for you. These 10 subjects are the high yield subjects. Even in for the upcoming NEET PG 2024, if you are not prepared anything, if you are in a dilemma like what to prepare, then always go ahead first with pediatrics, because pediatrics will give you the maximum output. Maximum output. It is not like you study medicine, you won't get output, but it will take time, and that time is wastage. Now the limiting factor is time, and with respect to time, if you follow the approach, the first should always be pediatric, then comes psychiatry, then pharma. So I made this into a pie chart, and you notice this according to weightage: pediatric, psychiatry, pharmac, ortho, surgery, OBG, until patho. This covers almost 60% of the graph. So 60% of your time is properly consumed if you study these 10 subjects only, and these 10 subjects are not the high yielding subjects only. You have combination of all subjects. You have short subjects like psychiatry, which can be completed in 1 or 2 days. You have short subjects like ortho, which can be completed in 1 or 2 days. You have short subjects like dermatology and forensic. So ultimately what matters in NEET PG is how many questions you get it right with a limited amount of time. That is the ultimate funda. See, toppers will have to study anything. So this video doesn't apply to toppers. They have to get 100% of everything. But to those people who have started now, or who have started earlier and now they have to revise, or they don't know what to study next, for those people this will be very helpful, because they will be knowing now which subject to study exactly and which subject will give you maximum output. Maximum output in a limited amount of time is the key to success in NEET PG. Take it from me. Got my point? So now I put this into a new strategy. The strategy number 3, that is the 10 game changing subjects. The 10 game changing subjects are, I have given this formula: P4, S4 and BF. So P4 means pediatrics, psychiatry, pharmac and patho. S4 is, that is 3 surgical branches: surgery, OBG, ortho and skin, that is dermat, and biochemistry and forensic. These 10 subjects, if you study, that will actually be a game changer for you, and you will notice a significant increase in your marrow GTs or GT graph, whatever you do in the GT ranks or GT score. You will see a significant difference, because based on last 3 years question paper only the marrow GTs are made, or based on last 3 trend only, 2024 NEET PG trend also will continue. It is not like it will directly go into some other trend. It is possible, but the probability is less likely. Here we work based on probability. Probability is the only thing that will help you in this. Okay, you can't exactly guess anything. The best thing is you take statistics from the previous year questions and then apply it to the upcoming exams. That is the best possible approach when you have limited time left. Okay, so how to strategize according to NEET PG timeline? Okay, so this was a query which I got many times, that since I had given a since I had given a strategy for NEET PG 2023, so sorry, INICET 2024. So many people asked me also to make a strategy for NEET PG 2024. Okay, so now we are here. This video was shot on March 16th. Okay, so we are on March 16th, and your NEET PG is in July 7. Okay, so last 10 days you will need for your final revision. Okay, those things which are memory based, etc. So that I have given 10 days. So approximately June 25 is this part. Okay, these 10 days are for the final preparation, the last second revision. Okay, and 1 month you will at least need for this first revision. Okay, so this will be around May 25. So you have time today from March 16 to May 25. That is almost equal to around 70 days. So I call this the 70-30-10 day rule, 70-30-10 rule. So follow this from today, 70-30-10 rule, where 70 days of your preparation will be dedicated to the first hand preparation. Okay, 30 days for the first revision and last 10 days for the final revision. Got my point? Okay. So how do you divide this 70 days? So you have 70 days. Okay. The video for how to prepare for those 30 days and the last 10 days, I'll release it when time comes. Okay, that is out of scope for discussion now. So 70 days, right now, most of you have completed your internship, and rest post interns are there. You are anyways free, so you'll have 10 hours at least a day. So you have 700 hours. So 700 hours you have to divide. Okay, so how to divide this 700 hours? This 70 days can be divided into 40 days and 30 days. Okay, so this 40 days are for this 10 game changing subject. 10 game changing subject, even though they are short subject, carries the maximum importance. So this 40 days are for the 10 game changing subject and 30 days for the rest 9 subjects. So the strategy number 5 is how you divide these subjects. Okay, so for 40 days for the 10 game changing subjects, and how to club this. Say 40 days are there, I have clubbed it in pairs of 5. Okay, so there are 5 pairs, so each subject pair will give you 8 days. Okay, 8 days is ideal. I have clubbed one big subject and one small subject. Okay, so that it will be easy for your preparation, and both are interlinked also. Pediatrics plus biochemistry is where you have to start. See, all these first 40 days, whatever you're preparing, no, that is high yield. That is so high yield that it will fetch you 60% to 70% of your preparation. So once you're done with that, rest 30%, even if you don't perform well also, it's fine. Got my point? So first you start with pediatrics and biochemistry, or any of this combination is fine. Start with pediatrics and biochemistry. I clubbed pediatrics and biochemistry together because many concepts of pediatrics and biochem are interrelated. Again, surgery and ortho both are interrelated. Pharmac and psych, again, so much interrelation is there. Psychopharmacology is totally based on pharmacology. Pathology and dermatology, again, very much they are interrelated. And OBG and forensic, even though they are not interrelated, I didn't find any other combination, so I put it. So first 40 days we'll have to spend in these, and you'll notice that after 40 days you'll have a significant increase in your GT ranks, or your maybe your GT score or whatever. You'll find a very significant increase. Okay, because of this 10 game changing subjects. Rest of the subject you have to give 30 days. Anatomy and radio will go hand in hand. Okay, medicine and physio will go hand in hand, ENT, ophtha, and PSM and anesthesia. So here each you can give 7 days. Okay, maybe you can take 1 or 2 days rest in between. So this is the strategy for the upcoming 70 days. Okay, for the next around 2.5 months. Okay, so in between you have to give grand test also. How to give grand test, how to analyze GT, and how frequently to give, how to analyze and make your strategy, that I have described in my previous video. I had created a video 2 weeks ago where I had discussed extensively about how to give grand test, how to analyze GTs, and how to improve your score in GTs. The video I have provided the link in the description. Okay, and also I will be releasing one more video ahead on GTs, grand test, that is how to analyze your GT. Okay, and how to review your GT. Reviewing GT is one more topic which I will touch up later on. Okay, that is the 6th strategy. Do grand test regularly. How many grand tests? 1 in a week. 1 in a week is fine right now. Then strategy 7 is approach to previous year questions subject wise. See, last in my previous video on INICET strategy, I made a video on how to approach anatomy. Okay, in that video only I discussed how to approach anatomy previous year questions. So I had huge comments, I had huge response from audience that I have to make a similar video for other subjects also, like for physiology, biochemistry, everything. So I can't discuss it in this video, but I'll assure you that in the upcoming videos which I'll be uploading, I'll be coming up with this with this previous year questions strategy subject wise. Okay, how to approach subject wise and how to predict which questions are asked in each subject in the upcoming. Just like I said in anatomy, in INICET, CNS anatomy carries the most important, and how I predicted that in upcoming INICET also definitely there will be 2 or 3 CNS anatomy questions. Similarly, I will be doing for other subjects also in the upcoming videos. Okay, that video can't be that concept can't be discussed here. So my job is to make strategies. Okay, your job is to learn. So strategic planning is bringing the future into the present so that you can do something about it now. See, from my research, okay, no one has discussed in depth the statistical analysis of previous 3 years and the trends of the subject to the depth that I have discussed here today. So now with this data, I can project what exactly will happen in 2024, and now I have brought it in front of you so that you can prepare and you can get good marks out of it. Okay, so making strategy is my plan. It will be helpful to you. Studying is your plan. Okay, studying is your job. So all the best for your studies. Study thoroughly. Okay, allot at least 10 hours per day for your studies, and you will notice that your ranks have improved and you will definitely get a good rank. Thank you.